Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on angioplasty. Angioplasty is the procedure that opens up the narrowed or blocked arteries in your heart. It is a treatment that can work well for people who have this problem. Angioplasty is done in a hospital, but it is not surgery. You will not have any incisions, cuts in your chest or heart. Angioplasty is a treatment but not a cure for coronary disease. Coronary disease needs lifelong management. Other ways to control your disease is by taking medicines prescribed by your doctor to help if you have high blood pressure or high cholesterol, a fat in your blood, or a bad cholesterol, LDL, and if you have a high blood sugar level. Leading a healthy lifestyle. Your doctor can perform an angioplasty using different methods. Your doctor will first give you an angiogram, which is the heart x-ray. Then he or she will talk to you about whether angioplasty is a treatment for you. Technical names for angioplasty are PTCA or PCI. PTCA stands for percutaneous transluminal coronary angioplasty and PCI stands for percutaneous coronary intervention. Now we will discuss about what are the benefits of angioplasty. Over 90% of angioplasties are successful, and this means that out of 10 people who get this procedure, 9 do very well. Blood flow through the artery returns to normal or near normal. Most people get complete relief from angina, and people with severe coronary artery disease may still have symptoms, but they feel much better. This allows people to be more active and comfortable. People recover much quicker from angioplasty than from heart surgery. During angioplasty, there is no incision, cut, or general anesthesia being put to sleep. Most people are walking on the same day. Most people go home the next morning. Some may be discharged the same day. People can usually do their normal activities within a few weeks after angioplasty. Then I will discuss how will I know that if angioplasty is a treatment for me. Your angiogram will show the blockages in your coronary arteries, and your doctor will explain the different treatment you might have. These treatments include managing your symptoms with medicine, angioplasty, and bypass surgery. The treatment that is best for you depends on how bad your coronary artery disease and symptoms are, and any other medical condition that you may have, or your lifestyle, and what treatment you would prefer to have. You and your doctor will talk about whether angioplasty is a treatment option for you. Then I will discuss what is angioplasty. When is angioplasty not a good treatment option? Angioplasty is not a good treatment option if there are many narrow parts in many arteries. If arteries are calcified, have a lot of calcium buildup or hardened, or the balloon cannot get through a very tight blockage. The catheter cannot reach a blockage because of a tight corner. What happens during an angioplasty? Angioplasty is done in a catheterization laboratory, also called as a cath lab. A cath lab is a room in the hospital that has a heart, x-ray and other equipment. This equipment helps doctors perform an angioplasty. Your doctor will insert a catheter, a small tube, into your body. To do this, they use an introducer sheath, a slightly larger tube. The catheter is inserted in either your groin or your wrist. The catheter is a small balloon on the tip. The catheter is moved through one artery into the narrowed heart artery. The balloon on the catheter is then inflated. This opens the artery so that more blood can flow to the heart, and the balloon is then deflated and removed from the artery. The plaque, fatty layer that cause the narrowing, is not removed from the artery. It is pushed against the wall of the artery. This allows more blood and oxygen to flow through the artery to the heart. Then the doctor usually puts a stent into the inside of your artery during an angioplasty. A stent is a small tube made of stainless steel mesh. It holds the artery open after angioplasty. When a stent is used, your doctor will place it over a balloon. When the balloon is inflated, the stent expands. It is pressed into the wall of the artery. The balloon is then deflated and removed. After the stent is put in, the inner lining of the artery will grow over it. This usually takes about 2 weeks. This keeps the stent securely in place. The stent is kept in permanently to keep the artery open. Stents lower the risk of this area narrowing again. Will my arteries get narrow again? Yes, an artery may become narrow again after angioplasty. This is called re-stenosis. If the artery narrows enough, you may feel angina again. Stents may help reduce re-stenosis. If 20 people get a stent, it would work for about 5 people. Re-stenosis can happen as the wall of your artery heals after angioplasty. A new layer of the tissue grows over the site of the angioplasty. This is the normal healing process. In most cases, this normal healing process slows down and stops within a few weeks. Restenosis happens if the new lining does not stop growing, and this can narrow your artery. Most cases of restenosis happen in the first 3 to 6 months after angioplasty. Restenosis is usually easily treated with a second angioplasty. What are the risks during an angioplasty? Now we will discuss the risks. Angioplasty is a common procedure. However, like any procedure done in the body, there are some risks. Some risks include bleeding, artery collapse, heart attack, strokes. In rare cases, an artery collapse or a damage is damaged by the guide wire or a balloon. This may happen 1 to 2 people out of 100 people who get an angioplasty. A stent can often fix this, but sometimes patients need emergency bypass surgery. And ask your doctor about the risk and benefit of angioplasty for you. How do I prepare for angioplasty? First, you will have an appointment at the pre-admission clinic. This appointment will happen about 1 to 2 weeks before your angioplasty. During this appointment, you will meet with your healthcare team. The members of your healthcare team that will come to see you are your angioplasty fellow, cardiologist training for angioplasty, your nurse from the unit of paramedic staffs where you will be cared for, or your cardiologists. During this appointment, your nurse or angioplasty fellow will examine you. They will ask questions about your health. It is important that you will tell them about the medicines you are taking, your medical condition, any allergies you have. You will have the blood test and electrocardiogram. Your nurse will show you video about angioplasty. Your nurse will talk to you about and before and after care for angioplasty, and you will learn how to prepare for it. You will need to not to eat or drink after midnight the night before your angioplasty. Take some medicines before the procedure. Your cardiologist will talk about the angioplasty procedure. You will learn about the benefits of angioplasty, the risk of angioplasty, and medicines you need before the angioplasty and how to take them. Your cardiologist may prescribe the medicines clopidogrel, Plavix, or prasugrel, Effient. He or she will prescribe one of them if they think you will need a stent. This medicine stops blood clots from forming in your arteries and inside the stent. The cardiologist will order this medicine for a few days before the angioplasty. Your cardiologist will also ask you to sign a consent form for the procedure. What will happen before the procedure? When you arrive at the hospital, you will be admitted to an inpatient unit, and here a nurse will help you to change into a hospital gown, help you to shave your groin, wrist or both, and place an intravenous IV line in your arm. The IV helps the doctors and nurses to give you fluids and medicines, for example, blood thinners and pain medicines. The IV helps them give you fluids and medicines before, during, and after the angioplasty. When they are ready, you will be moved to the cardiac catheterization lab. The angioplasty will be done there, and this is also called the cath lab. The cath lab is usually cool and asks for an extra blanket if you are cold, and the lights in the cath will be dim during the procedure. This is so the doctor can see the X-ray images more clearly. What can I expect during the procedure? Your angioplasty will take about 1 hour to complete. If your condition is more complex, your procedure will be longer. You will be awake, but your nurse will give you medicine to help you relax. For the angiogram, you will lie on the X-ray table. You will be covered with a sterile sheet. You will be able to breathe and talk, and an X-ray camera will move across your chest. You will be on a heart monitor. During the procedure, your cardiologist and nurse will explain what is happening. They will also ask what you are feeling. So you will get comfortable on the X-ray table. The area where the catheter will be inserted, your leg or wrist will be washed. This will help prevent infection, and your doctor will freeze the area. The catheter will go in using a small needle. It may sting a little. Once the medicine start to work, you may still feel some pressure in that area. Tell the doctor if you feel pain. When the area is frozen, your doctor will make a tiny incision cut. This allows a short tube introducer sheath to be inserted. This tube will protect your artery during your angioplasty, and then your doctor will insert a long flexible tube guiding catheter into the introducer sheath, and it will move through the main artery in your chest aorta. Your doctor will guide it to where the coronary arteries branch off to the heart. When your doctor will inject a small amount of X-ray dye through the guiding catheter, this dye will go into the coronary arteries and you may feel a warm flushing sensation when the dye is injected. This is normal and passes quickly. Your doctor will watch the movement of the X-ray dye on a screen, and the dye lets your doctor see the places where your arteries are narrowed, and you may be able to see the screen as well. Your doctor may ask you to take a deep breath and hold it for a few seconds. Your doctor may also ask you to cough after the X-ray is finished. This helps remove the dye from the arteries. Your doctor will look for the narrowing on the X-ray screen. The one in found a balloon catheter is passed through the guiding catheter. A guide wire inside the balloon catheter is then moved through the artery. The guide wire will stop when the tip is past the narrowing. The ballooning catheter is then moved over the guide wire. It will stop in the narrowed part of the artery. When the balloon is in the place, your doctor will slowly inflate it. It may be inflated several times to push the plaque against the artery walls and open the artery enough. The balloon is inflated for about 30 seconds each time, and when the balloon is inflated, the blood stops flowing through your artery for a short time, and this time is not long enough to damage your heart. However, you may have some chest pain. Tell your doctor and nurses if you have chest pain or any discomfort. Pain usually goes away quickly when the balloon is deflated. The balloon catheter is deflated and removed once your doctor is satisfied with the result. What should I expect after the procedure? After your surgery, you will go through 4 steps before you are ready to go home. These stages are wrapping up in the procedure room, resting in the recovery room, or resting in your hospital room, or preparing to go back home the morning after the day of procedure. Wrapping up in the procedure, when the angioplasty is finished, your doctor will talk to you about the procedure. Your doctor will tell you the result. They may even show you your artery on the X-ray screen. If your procedure was done through your wrist, the introducer sheath will be removed. It will be removed in the cath lab at the end of the procedure. Your doctor or nurse will put a damp on your wrist and the clamp will stay for about 2 hours for prevent bleeding. If your procedure was done through your groin, the introducer sheath may be left in place for 4 hours. This will allow time for the blood thinners medicines that thin your blood, such as heparin, to wear off. And then the second stage is the resting in the recovery area. After the angioplasty, you will be taken to the recovery area. You will stay here for 30 to 60 minutes. And sometimes people experience chest pain or discomfort right after angioplasty. This is usually because you are having spasms in your artery. You may have some pain because your artery wall was stretched during the procedure. This usually goes away quickly. You may be given medicines to make you more comfortable until the chest pain goes away. Your doctor and nurse will watch you closely. Tell them if you have any discomfort in the recovery area. The nurse will check your heart using a small heart monitor, blood pressure. They will monitor the blood pressure, groin or wrist, depending on which area the doctor used to do the procedure, and the blood circulation in your foot or hand. Then if the procedure was done through your groin, you will be asked to lie flat in bed and keep your leg straight. You must not move this leg. This stops bleeding from the puncture site. Small cut. Tell the nurse if you are uncomfortable. They will help you to get more comfortable. If the procedure was done through your wrist, you will wear a clamp and arm brace for about 90 to 120 minutes after the procedure, and this holds your wrist in a position to stop bleeding from the puncture site, and do not lift or turn anything with this hand for a few days. Then resting in your hospital room. When you are ready, you will be taken back to your hospital room where your nurse will check your blood pressure and pulse the puncture site and blood circulation to your foot or hand, and you may have visitors once you are settled in your room. If the procedure was done through your groin, your doctor will sometimes leave the introducer sheath in your leg for 4 hours after your procedure. If this happens, you will need to lie on your back with your legs straight for 4 hours. Your nurse will then remove this sheath using a clamp. Your nurse will apply pressure to your groin for about 30 minutes. This will help to prevent bleeding. When the clamp is taken off, your nurse will put a pressure dressing, transparent dressing, or a band-aid on your puncture site. You will stay in bed with your leg straight for another 4 hours. When you are ready, your nurse will help you get out of bed and walk. You will be able to eat and drink once the introducer sheath is removed. If the procedure was done through your wrist, you will be able to walk after a few hours of rest. Your nurse will let you know when you can eat and drink, and this usually is taken after a few hours after the procedure. Then preparing to go to home the morning after the procedure. You will have to do these things before you can go home. You will have blood tests, an electrocardiogram, ECG. These tests will make sure that your heart muscle was not damaged during the procedure. Your nurse will remove the dressing from your wrist or groin. Your nurse will apply a small bandage in its place. Your nurse will talk to you about doing your activities again. Your nurse will also talk to you about your medicines. You will be given any follow-up appointment with your doctors, and you will be able to go home when the results of your blood test are okay or within the normal range. What to do? What do I need to do after surgery? If your cardiologist put a stent in your artery, you may need to take clopidogrel, Plavix, or prasugrel for a while. You will take the medicine for the prescribed time. You will have to take it for up to 1 year. During that time, the lining on the inside of your artery will grow over the stent, and your doctor will tell you when to stop taking the clopidogrel, Plavix, or prasugrel. Take any medicines exactly as your doctor teaches to you. You will continue to take aspirin before and your angioplasty. What can I expect after I return home from angioplasties? Then activities. Do not do physically challenging activities during your first week at home. One example is heavy lifting. This will help your puncture site heal completely. Walk a slow pace unless your doctor says you can walk faster. Most people have no problems after successful angioplasty. They can do their usual activities within a few weeks. How quickly you return to your usual activities may depend on a few things. It may depend on whether you will had a recent heart attack. It may also depend on what type of activities you do. Your doctor will talk to you about this, and then feelings and coping. It is a normal to feel anxious, worried about your health after having problems with your heart. At home, you may start to think more about why you got coronary artery disease. You might start to think about how you can change your lifestyle to prevent more problems. This may feel overwhelming or depressing. You should quit smoking if you are smoking, and you should not take oily diet, and you must take white meat, and you should take fish in your diet, and which provide you omega fatty acids. You may feel depressed after being diagnosed or treated for heart disease. As you become more active, these feelings usually go away. Tell your doctor or family doctor if you feel depressed for longer than 2 weeks. He or she can help you feel better. Then lifestyle changes. You can be an important part of your own treatment. You can make changes in your lifestyle to prevent your heart disease from getting worse. So The risk factors that you can change are high cholesterol, diabetes, high blood pressure, sedentary lifestyle, not getting enough exercise, obesity, stress, and smoking. To make these important changes, you need to help and support of your friends, family, and doctors. Your heart disease can affect the people closest to you, and talk you with your family and friends and get support. This will help you and your family cope with any changes in your life. Support groups and programs are available to help you and your family. They can help you adjust to living with heart disease, and your heart care team can help you find the resources that fit your needs. You should remember that life can be fulfilling again. Modern treatment for heart disease work well, and patients live for many years after being diagnosed with heart disease. For many people, finding out they have heart disease is a chance to make changes. These changes can lead to a healthier and happier life, and you should also make changes in your lifestyle, and you may feel better than you have in years. So it was all about angioplasty and related risk factors and it about its procedure. So I hope so that this video will be more informative for the audience, and if you have liked this video, then kindly share this video with other individuals as well. And thank you for listening this video and watching this video, and kindly subscribe to my channel and have a wonderful nice day. Thank you very much.